The apprenticeship program is advanced training on top of the training that we already received, but I really believe that the training allowed me to be more confident when I call up the doctor's office or if I call the case manager, I know what I'm talking about. Things change, especially in healthcare, things change, so we have to stay on top of it. We got to stay knowledgeable on the things that we're doing.
The training partnership has been recognized by the White House for our registered apprenticeship model. We have the first registered apprenticeship for home care aides in the country. And what we're doing here in Washington State isn't just about Washington State. We're leading the way for the entire country. There are many trends facing us in healthcare. We've got seismic trends right now. We know that we have unprecedented demand for home care aides because the population is aging, and we're going to have to train, just in Washington State alone, more than 400,000 home care aides by 2030 in order to meet that demand. You know, we talk about the $200 billion avoidable care crisis. We have a lot of people in this country who are going to an emergency room for a condition that could have been prevented, or they're going to an emergency room for a condition that could have been treated at home or in their doctor's office. And we know from research that these home care aides could help prevent a high-cost, avoidable emergency room visit, for example. But today, they're not really focused on that. That's not their job. Their job today is long-term care, not whole person care. But we can change that.
I like to see things grow within the caregiving field. Like, I want us to be considered professionals. I want us to be put on the map that we are needed. We are the hand in hand. We are advocates. We are lifesavers to people that sometimes don't even have family members.
With a little bit more training and some technology that connects the home care aides to the consumer's medical home, we'll be able to help empower older adults and people with disabilities to achieve the quality of life and health that they want and deserve. Workers will be able to earn more because they've learned more and they're doing more. Consumers will win, workers will win, we will all win.
I'm raising a son, and I want to be like that first foundation. I want to lay that foundation to where he sees not only is education important and finding a profession that you love, but you want to find a profession that's going to help and impact your community, the society, and the world. And I want to keep learning. I want to keep taking classes. I want to keep talking to people, keep advocating, because a lot of people don't know exactly what caregivers do. A lot of people think caregivers are just, you know, some low-end maid just helping, coming to clean up a couple things, but we're way more than that.